Welcome back to the CX report, which is powered by EGS. EGS stands for Emerging Global Services. And I'm your host, Steve Shefveland. I am the founder and CEO of EGS. And the CX Report podcast is where we talk about all aspects, trends, technologies, just cool stuff, fun stuff, challenging, difficult stuff taking place in healthcare. Um, our organization and me personally, I spend uh, the bulk of my career focused on what's called the customer experience. And in this case, we can call it the patient experience or PX. So maybe we should call this the PX report. We call it the CX report for customer experience, which applies to patients. But more than just serving patients, our organization is actively involved in working with providers and their patients. So that's what we're passionate about. That's what we focus on. And in this podcast, we're looking at all kinds of different uh, processes, technologies, trends, so on and so forth. So I think this is episode 4 of our podcast. And Today's episode is one that every leader in primary care, specialty care, and I shall say especially FQHCs, federally qualified healthcare clinics, essentially community health centers, really, I feel needs to hear. But I think it's not just community health. I think it's all healthcare. So today we're talking about why it's no longer optional to outsource your most time-consuming, labor-intensive patient workflows. I'm very passionate about this. Yes, that's the business we're in, so I get it. You might say, well, it's obvious you're passionate about it. That's the business you're in. But I'm going to say whether it's our organization or just any organization on the planet that has tremendous experience in healthcare workflows, I really feel it's important that you talk to them and that you start to get comfortable with outsourcing a lot of these tasks. Not next year, but now, as in right now. So you could say in a month from now, which is next year, 2026. So this is what, December 1st today? So things like scheduling, referrals, revenue cycle management, RCM, we call it, population health, which is big in community health, outreach, Medicare, Medicaid campaigns, appointment confirmations. In revenue cycle, you're looking at, you can use automation and or labor to make outbound calls for collections, amounts that are still due, just patient navigation, patient access. And I should even say your internal IT and help desk support for your EHR. All of these tasks are heavy labor consumption. And it's very, very expensive depending on which state you're in. But no matter what state you're in, it's still very expensive. So the pressure on community health operations and healthcare in general over the last 5 years, healthcare and community health centers have faced what you might call the perfect storm. So Medicaid redetermination chaos that's going on, declining reimbursement rates, rising labor costs, which are really gotten high, especially in certain states, burnout across scheduling, front desk, revenue cycle management teams. Patient volumes are growing and growing. They're not shrinking, but they're shrinking margins. Increased reporting and compliance requirements. It really is kind of to call it a perfect storm. I think it's been a perfect storm that's been around for a long time, and it just seems to be getting worse. And I see a lot of healthcare organizations that are in this mindset of, we've always done it this way. It's apparently been working, or you think it's been working, and we can't outsource these stuff. We're like, scheduling is core to what we do, or revenue cycle management, we know how to do it, or handling prescription refill calls, or yeah, well, we don't have the processes that up to do it. We've got internal people that know how to do it. But quite frankly, these are simple in 2025/2026. These are relatively straightforward. I don't want to say simple, but for organizations that really, really know healthcare, it's relatively simple stuff. And you really want to you really want to think about what is it that we do as a healthcare organization. We're a hospital, we're a primary care operation or clinic, we're a specialty, radiology, cardiology, ophthalmology. I mean, you pick your specialty. I mean, what is the business we're in? Well, we're in the business of delivering world-class, awesome healthcare to our patients and helping them, preventative health and helping them be, be able to live their life. That's what you do. Um, you're not in the business of staffing and running what you might call a call center, a back office workflow center, but that takes a lot of your time. Call volumes have increased, authorization requirements have expanded, payers are adding more and more friction, more and more requirements. Patients are expecting faster access and now digital convenience. Staffing is harder and harder, and then you have turnover. 40 to 60% of your dollars within all things patient support, which includes all of these time-consuming workflows, um, could be saved. You could literally free up 40 to 60% of your cash that's being invested into this and put that either at top line or back into your operations somehow. So, scheduling, referrals, eligibility, prior authorizations, which is basically referrals, um, incomplete documentation, all of this stuff you're trying to do. But that's not the business you're in. You're in the business of hiring healthcare professionals in the markets where you serve, serving patients. You're not in the business of staffing large back office patient support operations. There's all kinds of organizations on the globe, in the United States, all over the world that are experts at this. Our organization is an example of that. So it's really important, I think, that you start to recognize that's not the business we're in. Look at industries like hospitality or banking and finance. They literally figured this out back in the early 2000s. And they're like, outsource this stuff. That's not the business we're in. Find another partner who's an expert in this and let them partner with us. So the new math of cost and workforce reality. Healthcare is one of the few industries still trying to staff huge operational teams domestically, just like I was talking about. Other industries have figured this out. So you got labor pool is shrinking, and some of these jobs in the United States are not really considered very good jobs. So you're sometimes you're just going to find a lot of people that don't want that job. Wage inflation is real. Turnover is 30 to 60% annually in front office and then even these back office roles. Um, Training cycles are long. They take time. The technology is constantly changing. It creates burdens. You have to keep upskilling your employees. It gets to the point where the math just doesn't work, and healthcare organizations of all types are either, you know, uh, operating operating at a loss, or they're at break even, or they're barely profitable. But when you look at some of these workflows, that it's like we've always done it, and it's like, why are you still doing some of these workflows? Outsource that, say 40, 50, 60, even while with a combination of labor, lower cost labor in another country, combined with the right AI platform, automation tech stack, you're looking at 75, 80% cost savings. And that's real. That's not just myself or others in the industry sort of making up a sales statistic. That's a real number. So I think the goal here, what I'm trying to communicate, is just to get people to start thinking in a mindset of, why are we still trying to do everything the way we've always done it? Um, let's focus on what we're really good at. That's serving patients, delivering healthcare, and all this other stuff. Let's find an expert to help us manage that and handle it. And let's start reducing costs. So I guess I can get a little more specifically. I touched on it already, but what workflows should be outsourced? Um, I think in 2026, I'll just call it that now. It's important to be looking at what I call a hybrid organization, because healthcare is deeply personal to people. But you look at the patient experience for a lot of healthcare organizations, and it's very frustrating. They're just trying to get in to see their doctor, their provider, or they've got a potential diagnosis or risk of something, and they're worried, they're stressed. They need to get in. They need to have easy access. And what I'm noticing is the healthcare industry is putting um, a lot of additional stress, emotional anxiety on patients when it's really not. It's not necessary to do that. But just scheduling and access center support is a very basic thing that should be outsourced. High volume, high complexity, high burnout for U.S. employees. You can outsource those. Now, I do believe there's value in looking at the employees you've currently got in your organization who are doing this work. You've got your top one third, your middle one third, and your bottom one third. Top one third you should keep. They're hard to find. You've invested in them. They're great employees. Let them continue to do some of this work. Find other work for them to do. I'm sure you have it. But the bottom one third, they're problem employees. They're turning over anyways. They got to go. And the middle one third, there's some got to go. Some should remain. So I think you're creating jobs locally, which is important. But there's a point in which you're in the business of creating healthcare jobs. That's what's important to think about here. But so we're talking about scheduling and access center support. These are things that are easy to outsource. It is going to improve speed of answer, accuracy, after hours coverage, multilingual support, referral management, the number one black hole in most community health centers, and quite frankly, a lot of healthcare. Um, Referrals go out same day, specialists respond faster, closed loop tracking improves, compliant gaps shrink. So there's nothing like being referred to an expert or another specialty group, and then you got to wait 3 weeks or 8 weeks and you can't get in. All of these workflows are slowing down the process, and the whole time the patient's wondering, is my condition getting worse? It's creating stress and anxiety. Revenue cycle management, eligibility, prior auth, and follow up. Payer rules change monthly. Hybrid outsource teams that can verify eligibility before the visit, handle prior auths rapidly, accelerate claims processing, reduce denials and rework. Medicare, Medicaid outreach, and population health. This is big in community health. Um, Community health has a huge demand for annual wellness visits, care gap closures, redetermination outreach, chronic care follow-up. Hybrid teams plus AI automation can deliver a 10 to 50x more patient touch points than an internal team can. So this is going back to this hybrid model of high quality labor combined with a great tech stack AI platform. And I think we're in the era where you have to be looking at ways to combine those two to really improve workflows, to really improve your overall operations, to improve the patient experience. Um, what else can be outsourced? Appointment confirmations and no-show prevention. Um, Automated plus human follow-up can reduce no-shows by 20 to 40%. This goes straight to your bottom line. We have multiple clients of ours that have said that once they outsourced a whole host of workflows to us and a whole host of what were internal sort of call center agents doing this work at their location, we we actively, as an organization, we were able to dramatically pretty much maximize their provider appointment schedules and reduce no-shows by 15, 20, even 25%. Right out of the gate. It happened very quickly because your outsourced provider is solely focused on this task. They're not trying to manage all kinds of other workflows. Um, the last thing that I talked about outsourcing is internal IT and help desk for EHRs. These EHRs are pretty complex. I know Epic takes a fair amount of work. Some of the other ones are a little more simple and easier to use, but there always seems to be some issues that have to be managed with EHRs. You have questions by your internal team. Having an internal help desk team that can handle these quickly and efficiently and effectively, that's very low cost, I think is very important. So that's another great area to outsource. And then just back office workflows, document indexing, inbound fax processing, credentialing support, chart abstraction, tasks that are labor heavy and expensive to handle inside your organization. Um, so getting back to this, why do I say, I take this position that outsourcing is not just an option anymore. In the healthcare sector, I think it's absolutely essential that you start looking at various workflows. Yeah, and you don't have to do all of them at once. Pick the low hanging fruit and start with that, and then take a look at the others. But force number one is the three major forces make outsourcing not just a strategy but a necessity. So force number one, cost pressure. Community health and healthcare in general cannot keep adding more staff to chase more tasks. You just can't do it. Hybrid outsourcing cuts costs 50 to 70%, and it stabilizes your operations. Hybrid meaning the use of highly trained labor in a lower cost market, another country where they speak good English, they speak great Spanish, because those are the two big languages in our country outside, others, but those are the main. And then you combine that with AI. You combine that with bots that can automate tasks, bots that can communicate in perfect English and a nice voice over the phone, can automate scheduling. There's a whole slew of things that AI automation brings to the relationship with the patient, and it now allows you to focus more and more on serving patients and getting more and more focused on delivering healthcare and taking more and more of your budget and applying it towards finding providers, nurses, what have you, versus having to spend all this money on all of this labor, which is just challenging to manage. Force number two, talent pressure. The American workforce isn't growing, and healthcare burnout is at the highest it's ever been. It's real. And, the hospitality industry, the banking finance industry, they realized this way back in 2005, 2008, 2010, and they said, well, outsource this stuff. It's too expensive. If you can't hire enough schedulers, revenue cycle management staff, referral coordinators, and IT support team members, you must look outside. You must start looking at other ways to deliver this. Probably better, faster, cheaper. You can find organizations out there that are real experts at this, and they're not only experts in the labor component, but they're also experts in bringing the technology to make the both work together. Force number three, automation pressure. Payers, insurers, and government agencies are enforcing automation readiness more and more. There's so much to keep track of now with all of these external forces that you have to integrate with and talk to. It's getting to the point where you start looking at each specific workflow and you start looking at, how do we automate this? How do we get this to just work quickly, efficiently, faster, at less cost? Because all of that improves the patient experience, which improves your brand and how patients view your brand and what they say to others about the experience they have with you and their doctor, their provider. So I guess I should talk a bit about, if you're going to outsource this, what should you look for? What makes for a good partner? Well, a lot of people have opinions on this. There's a lot of different, in fact, there's been a lot of different podcasts and webinars out there on this subject. Um, it needs to be an organization that is really passionate about serving patients and serving providers. It has to be an organization that lives and breathes your world. They're in business because they love your business. They love your industry. They love healthcare. That's critical. If they're just trying to do, you look at their website and they got 15 different industries they serve, or just 5 different industries, including healthcare. Well, that means what? 1/5 of their time is focused on you. So, you need to, what is that? 20% is only focused on what you do. So I would absolutely look for a partner or provider that is 100% focused on healthcare and all of these workflow models, all of these workflows and patient engagement work that has to be done. So that's number one. Number two is a hybrid model, humans and AI. We're at the point now where AI is rapidly evolving. It's growing so fast. Um, so AI is not just offshore staffing, not just software. You need both. You need you need lower cost labor, which is in another country that's high quality, educated labor. Um, you do need great software for the workflows you're doing, the EHR and all this and that, but you really need a great AI platform. So you need humans and AI working together. So I think it's critical that you find a provider that or a partner that is heavily focused. Their whole business is healthcare and what you do. They're all about a hybrid model, bringing great, highly trained and experienced labor, which is what you need and want and expect, and you're constantly trying to staff, combined with great technology, great AI. You want to find a provider with, I talked about this deep experience in healthcare, but healthcare workflows, scheduling, referrals, revenue cycle management, prior authorizations, all of this, IT, help desk. These require highly trained teams with a lot of experience. I really think it's important you find a partner that is relatively close to the US, close to your time zones. It's just so much easier. It's easier. They understand the US consumer, the US patient. They're on your time zones for the most part. There's a lot of great organizations. I mean, obviously, our organization does this. We're based in Phoenix, but we have all our operations in northern Mexico. Whether it's us or whether it's another outsourcing provider that does this, it's critical that you find them. Compliance ready, obviously HIPAA, anytime, all the security, all the security that needs to be brought to the relationship, quality assurance auditing, daily, weekly, detailed reporting. Um, in this business, you make decisions based on data, and then you make decisions. The data drives how you leverage quality live agents with technology working together. I think it's important you have real transparent pricing and a clear ROI, and you scope out projects very specifically so you can. There's low hanging fruit initially. It's simple to execute. You know that there's experience there with your provider and your partner that you choose. Um, and you launch it and you measure it and you set clear goals and objectives of where they need to be and you hold them accountable. Essentially, they need to be an employee of you. They're your employees. They can't just be a vendor. They have to be an extension of your organization. So it's very critical that you find a partner or a provider in this space that is um, all about you. They care about you. They're simple, easy, flexible. They're simple. They're entrepreneurial. I guess I should have said they're easy to work with. They're flexible. They care about you. They care about delivering a world-class patient experience because that's really what you're looking for. When you hire people internally, you want those people to feel that way. You want them to work that way. Um, so just to close out this podcast segment, freeing your team to really focus on care and focus on delivery of healthcare, not to spend all their time focused on workflows and working with insurance providers and doing scheduling. I mean, this stuff is super, super important, but it's kind of this boring. It's all these workflows, get overwhelming, burdensome, kind of boring. You get a lot of labor, a lot of employees doing this work and they get burnout, and it's like you can automate this stuff and you can find other providers out there. This is all they do. This is the business they're in. So that you can free yourself up to focus on what it is that you actually do. You're not in the business of all these workflows. You're in the business of delivering a world-class care to your patients. So all of these administrative tasks, just outsource them. There's a point at which you just got to stop holding on to them and just even if if the perspective of the organization has always been, we've always done it this way, we can't do this. All these people are going to lose their jobs. You know, every organization on the planet has people that need to lose their job. They need to go. Those are easy people to move out. Yes, you have people in your organization that are amazing employees. You want to keep them. I think the outsourcing industry has gotten labeled as, very negative because you're just eliminating jobs. That's really not the issue. We're trying to fix workflows. We're trying to fix the patient experience, but we're trying to do it in a way that's cost effective so that you're not operating on a negative cash flow, a negative a net operating loss. You can't do that. No business can do that. So I think it's important I'm just trying to encourage you to yourself, your board of directors, to realize that there's a time in which you just need to start looking at these functions, these basic functions. Stop trying to do it all. It's too much. It's just too much. And the big industries of the last 20 years outside of healthcare learned this a long time ago. So I think it's important now for the healthcare industry to start to realize that we need to do this, or we should be looking at ways to do this, and start small. You don't have to start with everything. Just pick low hanging fruit that's simple and easy, that's taking up time and costing you a lot of money, and just start with that. So I guess I'll end it there. I think my goal of this is just to get people to really think more and more about this. And obviously, my organization, EGS, Emerging Global Services, this is what we do. But I can tell you, there are a lot of other organizations, on the planet that do this work. So, anyway, I just want to encourage you to start really thinking about this since we're going into 2026. Start simple, make it successful, measure it. I should say, measure it, make it successful, and then realize the results. So, anyways, you can always reach out to me if any other questions, Steve at emergingglobal.com. I'm happy to direct you or talk to you further, and wishing everybody a good holiday season, and which will soon be Happy New Year.